Hey guys, AJ Town with the T Storm Chasers here with Maddie from Encompass Mental Health Counseling to bring awareness to the Suicide Prevention Month. As we are going to jump into that and kind of discuss with Maddie what signs are going to be there, what resources are going to be available, and what we can do to help those that are in need to really prevent that suicide prevention that is bringing attention and bringing it a little more forward this month is ultimately the goal between people with this month is to bring that more awareness. So with us, we have Maddie. This is one of our first podcasts slash second one because our first one unfortunately didn't work and didn't really come out the way that we hoped. So we have to re-record and we're gonna see what we can come up with and hopefully this one's a little better. So, again, we have Maddie with mental health, Encompass Mental Health, and
Hello. Thank you so much for having me. I'm so excited to do this. This is a super important thing to focus on. That's why there's a whole month about it. 2 days ago, it was actually 988 Day. I don't know if you saw that. Are you a Bears fan by chance?
I I am I'm
Okay, so you saw the QB had 988 painted on his nails. For 988 Day. So that was a really cool nod. And the whole month focusing on suicide prevention and the services that 988 provides, as well as how an outpatient clinic like Encompass can help.
so what we'll kind of talk about here is kind of what is Suicide Prevention Month. What is it, and you know how is things available, what is available and stuff as well. What is Suicide Prevention Month? As why is it so important to bring awareness to others?
Suicide Prevention Month is focusing on the fact that we have a mental health crisis in this country. Specifically in the Midwest, we have a really high rate of farmer suicides. So they actually have a specific crisis line for farmers to call with additional support related to them. And so suicide prevention doesn't just look like making that call, though. Suicide prevention is making sure that people are having the supports that they needed, that they've got food on their table, that all of these things that lead up to somebody having those thoughts and doing what we can to try and intervene as early and as often as we can to give them the best chance for their outcomes. So it's more than just a month, right? We're doing this all year long, but making sure and highlighting and really focusing on shining a light on this preventable cause of death.
So I know one thing that we discussed the last time, and kind of bring that back up is Suicide Prevention Month. Is there anything else that goes on throughout the year for suicide prevention, and what aspects are there for that? As far as suicide is 365 days a year, 7 days a week, 24/7. It just doesn't rest. So why is Suicide Prevention Month not more, or is there more events?
Yeah, there is. So May is Mental Health Month in general. And then in October, you have World Mental Health Week, which is the first week of October. And so obviously, though, if you ask me, it should be, like you said, 365 every day, that we are like doing this work and making sure that we're checking in. And one of the most effective questions that we can ask people, or anybody can ask, is, are you thinking about suicide? And just being willing to ask that very direct question. Because we ask it, and even like myself, for instance, I ask it in a frame that assumes that somebody is, because if I say, are you, you're more likely like, no, 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 no. But if I say, when's the last time you thought about suicide? You're more likely to give me that honest answer of like, oh, actually, sometimes that comes up for me. And then it opens a door to a conversation. Whereas if I just glance over it, right? Sometimes you go to the doctor and they'll ask you those questions and they're rushing through it. And I know they're busy. They're asking, are you safe at home? Are you suicidal? Are you, and they're getting through all those intake questions. But when we stop and take a second, when's the last time you thought about hurting yourself? We can really have a chance to intervene and anybody can ask that question. If you feel like somebody is struggling and you want to do that, I would really encourage you to do so, and then be open to what they tell you and not be scared, and have some of those tools and say, okay, I know what to do now. And if you don't, you can absolutely call 988. You can call our office. We can help you get to those next steps when somebody does say, yes, I am.
So one thing that kind of with this month and stuff is to bring awareness and to let people know what's going on out there and everything. What are some common misconceptions people have about suicide and those who struggle with suicide thoughts as well?
Yeah. Common misconceptions would be that it only happens to certain types of people, right? That it only happens, that it's some sort of sign of weakness. That's just absolutely categorically false. It is a symptom of a larger illness or stressor that's going on in somebody's life. And so it really can. And you can't just look at somebody and tell if they're depressed or not. And so, I mean, we've lost celebrities to suicide, right? People that you never would have looked at and been like, they're depressed, right? Robin Williams, a huge example, lived his life making people laugh and ended his own life, right? And so you can't just look at somebody and know what's going on beneath them. A big reminder that I have for myself is that we're all waging quiet wars. Like, we don't know what somebody is going on. And so leading with empathy and grace and having those hard conversations to check in on the people that are important to us and the people that we care about and the people in our lives can be truly a life-saving measure.
So it is definitely something that it's going to affect everybody. It's going to affect the person. Statistically, what does it affect one out of how many people?
Out there, I do not have that answer for you. I don't know. One out of every, I can tell you that 1 out of 6 children are diagnosed with a mental health condition. I know that statistic, but I do not know one out of how many people have been touched by suicide.
It's actually probably a lot more than what the average person would think.
Oh, absolutely. Absolutely. It's definitely, I can think, obviously, like, I do this job for a living, but even before I did, just in like my upbringing, right, there was at least 2 that I knew that, it was a friend or somebody, that like their parent had died by suicide. And so, yeah, it's probably a very high rate of it for sure.
What are some warning signs and risk factors that somebody is looking at that option of suicide or heading down that path where you will have time to intervene and make sure that that person does have some help?
Yeah, yeah. So looking at those signs and symptoms, losing interest in things they previously enjoyed, having a difficult time with sleep. Sleep is a huge impact on our mental health. Maybe changes in their appetite. They might be sort of saying big huge warning sign would be starting to like say goodbye or to like give away some of their things. We don't always see that though, but it's your pretty typical depressive symptoms. So, feeling down, depressed, hopeless, not wanting to get out of bed, do things that they enjoy, spend time with people that they care about. Maybe their hygiene has changed. They're starting to mention death or be, like have more conversations around like, oh, I wonder what it's like afterwards. Would people miss me? These sorts of questions are going to be those really big red flags. And then to just be very direct and honest and say, like, are you thinking of killing yourself? And having that, conversation, and rather than trying to band-aid over it and say, oh, we would miss you, please, blah, blah, blah. Like, that's not going to necessarily change their mind. So we want to intervene and get professionals involved at that point. It's not, that's our instinct, right, to comfort, and it's a very natural and normal instinct to do, and we need to reach out to professionals.
Are there risk factors that friends, families, or coworkers should be especially mindful of?
So risk factors would be like easy access to firearms, Men and women attempt at roughly the same rate, but men tend to pick means that are more lethal. So the largest way that people complete suicide successfully, which seems like an odd way to phrase it, is with the use of firearms. And so more men die from suicide, but it's not because more are attempting, it's because they're choosing more lethal means. So a huge risk factor is if there's unsecured firearms in the home. And then you start to look at access to medications. That's another way that people attempt commonly. And so if we can remove the means, we can really help secure and make the space safe. Whether that's, by locking it, changing the password, changing the safe, getting them out of the home, locking medications, having somebody else keep track of them and giving them to you in like daily amounts rather than being able to like take a bunch all at once. All of those things are risk factors and ways that we can intervene to lower them.
How can we tell the difference between someone just having a bad day and someone who might be at risk?
Are impulsive because the part of their brain that makes good decisions is not fully developed yet. It is not all the way online. And so they are much more impulsive. So there are several times, unfortunately, where I work with teenagers and they did just have a bad day and they're like, I'm just going to die. Right. And so they will start to spiral down and have those really depressive thoughts. And it can turn quickly. But that has a lot to do with impulsivity. And so to be able to tell, like, if it's a bad day or if it's if it's something that they're thinking about or they're bringing up or mentioning more often, or you're starting to see more and more of those warning signs, it's not just a bad day. But even if somebody is having a bad day, like sometimes I'll even get like small children who are having like a big meltdown and they will threaten it, right? And then it really scares their parents, and so then we will assess and say like, okay, is this something that they said out of anger, or is this something that they're truly thinking about? And sometimes it's tough to tease that out, and that's why you get professionals involved, because I would never expect a parent to be able to know if that's something that their child said because they were upset or if it's something that they're really thinking.
Along those lines of how can we tell the difference, what is one way that we could, um, what's a safe and helpful way to prevent the risk or to prevent the actual suicide occurring? I know you mentioned doing the safe and doing the medication, getting that out of the home. Are there resources available for people that are actually struggling?
Taking accessible. So there are like medication disposal places. Like you can get a list from like pharmacies, or sometimes they will have like a pill drop off. I know where I grew up, there was one generally outside the police station, so that way they could be disposed of correctly. And so finding those is a big help, because then they're just like not accessible. Having your guns locked up and the ammo stored separately. But then as far as like area resources, you can call 988. You can go into any emergency room and say, I am not feeling safe, I want to die, I want to kill myself. And they will assess you, and likely, if it's to that point, admit you to the local behavioral health unit, which is a crisis stabilization unit. Roughly 5 to 7 days you're going to stay there. That's not a hard and fast rule. I've seen some as short as 3 and some as long as 2 weeks. That they will help you stabilize. Maybe we need to adjust medication. Maybe we need to get some additional supports, up your outpatient counseling, start outpatient counseling, any of those things to help you get more support once you have stabilized in the hospital. If this becomes a recurrent thing and you have gone to this short-term crisis stabilization unit several times, they might look at a longer-term hospitalization at the state hospital, which we have down in Yankton as well.
So one thing with South Dakota is we have Sioux Falls, we have Rapid City, but between Rapid City and Sioux Falls, is there a mental health place that's available for people to go to, besides just the ER for like an inpatient treatment? or is it just only the Sioux Falls and Rapid City area?
I believe there's one in Aberdeen, but don't quote me on that entirely. And it's also different between minors and adults, right? And so if a minor is having issues longer term, there are residential facilities that they will go live in if they are having a lot of behaviors. They can't be safe at home. We have several here in Sioux Falls as well as in Rapid City. But again, it's kind of those two poles, it almost feels like, that just kind of like split the state. Again, you can go into any local ER in any small town. It just might mean that you end up being transferred to Sioux Falls or Rapid City to their departments.
So if somebody is looking at doing suicide and you're talking to them and everything, is there certain like keywords to avoid saying so then it doesn't trigger them more, or is
Mm,
there anything along those lines that what are safe and helpful ways to start that conversation
mm-hmm.
and lead them in the right direction?
Mm-hmm. Yeah. So this is where a professional would start to use some of those like um, interventions that we are trained to do, as well as the assessment piece. So we're going to ask questions about what's their plan, what's their means, why do they want to do this, and do they intend to do it? And all of those things are sort of a piece to the puzzle. I don't expect the common average citizen to know to ask those questions or to feel comfortable asking those questions. And that's okay. You don't have to, but you're not going to screw it up. You're not going to, I mean, now if you directly are like, well, I think that's a great idea, that's something I would not recommend saying. That would be really unkind to say. But if you are coming from a place of empathy and wanting to help, don't feel like you're going to screw it up. Asking is so important. Don't worry about asking the right way.
And one great resource for everybody, whether they have a landline, a cell phone, or a computer available, 988 is available, and 988 will connect you to resources that are both local and on a national level as well. You mentioned earlier that the Chicago Bears, they had a 988 on it, and 988 is available. We'll have 988 in here at a later episode as well to discuss what 988 is and kind of their point of view of things as well. But you can be in Florida watching this and call 988 if you guys need that assistance. 988 is available to anybody nationwide and will connect you to the local office that then can connect you to the right resources in your area as well. But looking at it as far as 988 is there for a very, in your mind, a short term, and then you guys are more on the long term side of things as well with that. So
Yeah.
you can definitely help with the long term capabilities. One question that I do have as far as that long term capabilities is I'm thinking about it. I need to look at, coming to see you. I need to work with you. We need to do an intensive program with you. What options do you have as far as on the therapy side of things to do that? Do you suggest maybe going to BH, or are you able to help somebody work through the process, seeing them a couple times a week, and then can you kind of discuss that process of it?
Absolutely. And there's no necessarily right place to start in this sort of workflow of options. It is totally fine however you start. What is most important is that you start, that you pick up the phone, you call us, you call 988, you call your local emergency department. It doesn't matter where in that circle you start. We can help you get where you need to get. Please just make that phone call. So if you've been hospitalized and you've had stability, or maybe you don't need to be hospitalized, maybe you can be safe at home, but you're having these ongoing thoughts, then you come and meet with a therapist at an agency or a clinic like ours. and you meet with them and they're asking you these questions, they're assessing for safety, they will determine what is medically appropriate for how often you are seen. We call it like level of care. And so typically everybody, kind of your average person, is going to start out seeing their therapist once a week, and if they are needing more intense help, maybe that moves up to 2 times a week. Anything more than that, and we might look at something that's called intensive outpatient, and there are programs available to do that where you would spend like half the day in the hospital, but you would still go home, and you do that 3 to 5 times a week with decreasing intensity until you could safely return to an outpatient therapist at 1 to 2 times a week frequency. But again, it doesn't matter which one you've called first, it just matters that you call.
So one thing that you did mention, and we kind of discussed um, at the previous one, but wasn't brought up yet, is okay. I'm ready to get help. I need to get help, but I'm looking at my bank account, and the bank account's not showing enough funds to be able to come help, or my health plan doesn't cover it, or what options does somebody have to come in and get that help that is necessary, and to be able to come in and see what's going on, as far as what's going on with their life and how to get through this, and and to be able to afford it in a sense, versus coming in and you know gosh, I need help, but now I'm struggling with money, and I'm struggling with this, and everything's adding up to where it's pushing me away from going to get help because of that option. What options do you guys have as far as the clinical side of things, and then maybe as far as even the state side of things?
Definitely. It is, it can be a financial burden, which is so unfortunate because people need these services. So there is Medicaid, which is enshrined in South Dakota state constitution, that certain populations of people are eligible to receive state insurance, and that covers mental health care at 100%. So if you have Medicaid, you do not pay a dime, right? And so that's something that is really helpful. There used to be some Medicaid plans that you'd pay like $3, but they even got rid of those. So there is no barrier to access. Now, if you have private insurance, it's going to cost more depending on your plan, and every plan's a little bit different. Probably the most common plans that we see are a copay plan. So you're going to pay to come see us the same thing that you would do when you go to your doctor for an ear infection. If it's a $25 copay, 10, 15, I've seen some that are like 50. If you have a high deductible plan, that means that you pay up to your deductible straight out of pocket, and that's the hardest one because these visits are happening every week and they can be costly. So there are programs available to help cover some of those costs. There are agencies that offer free and reduced services. We have a reduced rate if somebody does not have insurance, or it's an insurance that we don't accept. And so we want to make sure that people are seen. We have partner organizations, we have a partner nonprofit. We're trying to reduce these barriers because money should never be the reason that somebody doesn't get help.
Does therapy, in your opinion, help people who are dealing with suicidal thoughts or severe depression, or heading down the path that they shouldn't be heading down? um, I know therapy can help a lot with the resources and everything, and what's after doing that, what are some strategies or tools that you guys utilize in your program when people are looking at doing that?
So, some pretty common modalities or strategies that we use in therapy would be things like CBT, which stands for cognitive behavioral therapy, or DBT, which is dialectical behavioral therapy. So, the premise of CBT is really that the way we think affects the way that we feel, and that affects the way that we behave. And so, we work to change the way that you think about things. And if we can change that, those links change on their own. And so that's really cool to see. And so I always use this example, is that if I am a little kid in bed and I am scared and I'm hearing a noise outside my window, I might tell myself somebody is trying to break into my house. That's going to scare me further. It might cause me to run out of my bed and into my parents' room. And they might say, oh, you're being silly, just go back to bed, or oh, come here, those sorts of things. But it started with the thought that I had. Now if I'm laying in my bed and I hear that same scratching and I think, oh, that tree branch, my grown-ups keep needing to cut that, and that's the story I tell myself, I might be a little annoyed, but I'm going to be able to fall asleep. And we can do those same things when people are having those negative thoughts, when people are having suicidal thoughts. We can work to change the thought and everything else changes.
So one thing to look at as far as maybe um, changing things is chemical side of things, like such as medication and stuff that is necessary. Um, is that something you guys do, or can you lead somebody in the right direction for that, or where does doing therapy as far as verbal and sitting down and talking with somebody to work through it is one thing, but then the other side of things is keeping that mentality there. What different options does people have as far as maybe looking at doing some medication or things along that line? If they need to go to the medication route, does their therapist typically, can they issue that? Can they, where do they need to go to be able to seek the medical medication that they need to be able to?
Therapist would not be a prescriber. A licensed therapist is not trained in psychopharmacology in the same way. We take like one class on it in grad school, so we have a basic understanding of the classes and the types, but we have nothing to do with dosing, side effects, anything like that. We will not prescribe you medication. We do have referrals of people that we trust and work well with that we will refer people to if they're interested in medication management. And so there are things like antidepressants and mood stabilizers that might be very beneficial for somebody with severe depression and suicidality.
What is the most powerful, successful story or moment of hope you've seen in doing this? Because you've done it quite a while. I, I'm not calling you old, no, but on the flip side of
Yes,
that
yes.
is we talked prior off camera,
Yeah. Mm-hmm.
that have been doing this for
Yeah.
quite a
Yep.
while, and so looking at that, what's one of your most successful stories that you've had or moments?
Yeah, that's so tough because yes, I have been doing this a long time, and so, but it was there was a young boy very early in my career that had come from a rough place, and we were able to connect because I tell people all the time that I could have the best interventions in the world, but if you don't like me, this isn't going to work. And so building that relationship first as a therapist is so important. And so, this kid is a grown up now and hopefully doing wonderful things, because when they get to a point where they don't need me anymore, then I don't get to know, which is kind of tough for what we do. But he, went from having a really tough time, residential facilities and those sorts of things, to being successful in life and the goals that he had set for himself. And so he didn't need me anymore. And that's hard because I don't, we did all this work, and like a teacher, you get to like follow them after graduation or see the wonderful things that we do. And part of our ethical code is we don't have another relationship with them afterwards. And so that's tough, but it's a wonderful thing because then he didn't need me anymore.
If someone is listening right now to this podcast and they are struggling, what's the one message you'd want them to hear right now?
You are so important to this world, right? There are so many things and so many tomorrows that you are still supposed to get. Please pick up the phone. You can call a friend, and I hope that they listen. You can call us. We will listen. You can call 988. But this world still needs all of the wonderful things that you are supposed to do. And there is a way through it. It's going to be hard, but you can do hard things. And the way that you're feeling right now is hard. And we can find something through that together.
So one thing you mentioned is picking up the phone, giving you guys a call, or calling 988. If they happen to give you guys a call and are struggling, are your receptionists trained to recognize that, or is when they call they're automatically they'll get one of your therapists, or how does I need to call a counselor? How does a typical person call a counselor, and who's on that other line?
Call us, you will get our admin team, who is three really wonderful people, but they are not licensed therapists. So if you are calling and saying, I am actively going to harm myself, they will tell you to hang up the phone and go to your closest emergency room or to call 988, because they're not a crisis line in that way. If they're saying, I'm having suicidal thoughts, we will get you in as soon as we are able to. Absolutely. But if they are an active danger to themselves, they need a crisis intervention, which would be calling 988 or going to your local emergency room. Our receptionists are wonderful and will help you find you the therapist that's going to be the best match for you. But if you are actively in danger, please use one of those more immediate resources.
So speaking of resources that are available, speaking of things that are going to be available with, I call 911, I need that resource, and you know, officers come out, or how does that typically work? And then, if you have somebody in your facilities, do you guys reach out to police without them knowing? What's your steps in as far as police and stuff as well?
Yeah, so in the general day to day world, if you call 911 or 988 and you are like actively a danger to yourself, they may dispatch law enforcement to come and make sure you're safe. If one of your friends says, I have a plan, I'm going to kill myself, you are absolutely allowed and encouraged to call in a welfare check on them, in which officers will go out and make sure that they are okay and intervene how they are able to. In our office, it thankfully does not happen with any regularity. The only time that we would be calling law enforcement is if you were a danger to yourself or other people in our office. And knock on wood, that has never happened. But we have protocols and things in place if that were to happen, to make sure that we keep, because there's a lot of children in our office, to make sure that everybody is safe. So you can be assured that there are measures taken to keep our office safe, to keep you safe, to keep ourselves as therapists safe. But we would never like call law enforcement behind somebody's back.
So with that being said, do you get the patient's permission to call law enforcement, or is that ultimately like your judgment call, or how does that side of that work? I want to come get help. I want to do that. I want to come talk to you. I want to sit down. I'm thinking about doing suicide, but I don't want to walk out of your facilities in handcuffs. You know.
Can't imagine that any police officer is going to handcuff them in general if they're having a hard time. But if you want help, absolutely. And if you're like more in need of a ride there than like anything, like that's different than like law enforcement doesn't really need to be involved unless like really the only times that like I have ever had to do this in my career is like when it is a like minor who, so I used to work in homes years ago for a community mental health center. And so
There's that comment years ago.
yeah, I know, years ago. And well, it was years ago. It was a long time ago. It feels like a different life. And so sometimes if the child was like being violent, we would have to call law enforcement because they were threatening themselves or others. But like the parent was aware of that, and then the law enforcement would come to the home and need to remove the child and take them to the ER directly. But in our office, that has never happened. And so if somebody is like, hey, I would like help and I think I need to be hospitalized, generally they'll just take themselves, or their grown-ups will take them if they're a minor. But if there's letters behind our name, obviously, and some of those being QMHP, which stands for Qualified Mental Health Professional. So if I think somebody needs to be hospitalized, there's a county mental health board that you would go to and say, hey, this person should be hospitalized. And then it can be like become court ordered that they have to be hospitalized. That's not very common, because most people recognize that that's the case. And the ones that might be court ordered, that's probably much more than just suicidality. It might be like a psychotic disorder or something like that.
So going to a therapist is basically like the safe zone
Mm-hmm.
where I can sit down and I can tell you, basically almost anything within reason of what's going on in my life and everything, and not have to worry about walking out to a cop that's going to be standing at the door, or evidently if I admit to murder or something along that line, that.
There are bounds of confidentiality in which if you tell me I'm going to leave here and hurt myself or somebody else, you are telling me that you are hurting a child or a dependent adult, you are a child or a dependent adult and are being hurt, then I have a legal obligation to assure safety. But outside of that, no. I get a lot of teenagers that will be like, are you going to tell my parents if I drank alcohol? No.
Yeah, that's typically a lot of people's concerns is
Mm-hmm.
as far as the safety side of things, as far as a safe zone is kind of what I call that, is where if I walk into your office to sit down to discuss anything with you, where's that gonna go, and where's that gonna who's that gonna bring into my life, and things like that. But a therapist office is a safe spot, no matter what you're struggling with in life, and no matter what you're doing in realistically. I mean, of course, there's legal stuff and things along that line, but I mean, if I'm actively looking at suicide and stuff along those lines, it's a safe spot to come and sit down and talk to somebody and not have to worry about anything, correct?
Yep. Yeah, and I tell teenagers and kids all the time, I don't have to send you to the hospital if you can be safe at home. So if we can make home safe, you can stay at home and we can work on this at an outpatient level. Hospitalization is for people who cannot be safe at home. And so if you can be safe at home, great, that's where you should be and we can work on this. So it's not this big scary thing. A lot of times teenagers are very afraid to tell me because they think I'm just going to send them to the hospital. It's like, nope. I'm not. We can take steps. We'll make a safety plan. We are going to let your grown-ups know and we're going to make sure that we can keep you safe. And now if there are ways, if you have a plan in which we can't take those means away, then we may need to hospitalize you. But by and large, we can make a safety plan to keep you safe for, for within reason, right?
So if you're having the thoughts and everything, and need to come see you, do you guys open up availability? Does some of you guys at your office stay maybe a little later to work with that next person, or what's the process of trying to get in? Because I doctors, you you
Mm-hmm.
doctors are. I got a heart condition. I need to go to my heart specialist, and now I can't get in for 3 months, even though
Yeah.
I'm having
Yeah.
chest pains
Mm-hmm.
today.
Yes. Yes. Well, and in
So
that instance, if you're having chest pains, you need to go to an ER. But if you are calling, um, sometimes we can have same day appointments, but it's not like how a doctor will reserve like a couple for like day of, right? Like if your kid wakes up sick and you call the pediatrician, they're like, oh yeah, we'd saved this 2 spots. That's not how our clinic runs. We run on recurring schedules. So if you call in and we say, hey, Amber has Tuesdays at 11, that spot is yours for as long as you need it, every Tuesday at 11. And so we do that to make sure that it isn't 3 months between your appointments with your heart specialist. And so we're not going to give you an appointment unless there is room for you, because you are so important and your time is so valuable to us that we make sure you have that time as much and as long as you need it.
what's the best way for someone to reach out for help in a crisis?
988, 911, your local emergency department.
Are there organizations hotlines? Well, we've already covered that.
For a really long time, but it didn't always have that short code. The suicide hotline used to have like a 1-800 number that was longer, and then there was this big initiative to make it simpler and easier, and obviously like everybody can remember 988 the way you remember 911. So that was a really cool move that they made, to give it just those 3 digits. It's really easy to remember and you'll get help. And I love that you can text it too. That's super handy, especially for the teenagers that I work with, that maybe prefer text or don't want to hear, don't want their parents to overhear them or whatever, those sorts of things.
All right, go ahead.
So at Encompass, we have 17 therapists on staff, who see anybody from a range of 2 years old and 65 years old. So we all have our specialties. And so we do a really good job of trying to match who's going to be the best fit, not only with specialties, but also with personality. Because, like I said, if you don't like me, none of this is going to work. And I, as you may have guessed, am a bit more direct than maybe some of the other people. And that works for some people. And for other people, that would be too abrasive. And they need somebody more like Sarah, who I adore. And she is just the best, but we definitely take different approaches.
So if somebody needs to reach out to you, there's a couple of different ways that they can reach out to get an appointment scheduled. What are those ways?
Absolutely. You can give us a call at 605-275-0009 and be connected with one of our wonderful administrative staff. You can go on our website. We have videos of the therapists. There's actually a therapy match tool, which is super cool. Right up at the top, you see it there. That will give you a score of who is going to be the best fit for you. And you can book an appointment directly through that website as well. And then you can text us as well if that's your preferred method. And again, you're going to get our administrative team. So it's the same number, but you can text it if you'd prefer.
I just saw since I pulled up your website there, there's a little chat box there too.
Mm-hmm.
Does
Yep.
that connect to you guys as well?
So that is handled through our the same like scheduling system. It's a bit more automated. It's not directly our administrative staff.
All right. Well, I appreciate Maddie for joining us during this crisis month of Suicide Prevention Month, of making awareness to everybody. And thanks for coming in a second time where we had that technical glitch of our microphones just sounded horrible. I'll throw a clip up just so everybody kind of knows what I'm talking about. And yeah, don't wear earphones on this one, but yeah, we'll I probably won't be that mean and throw a clip up, but we'll certainly I appreciate her for coming back in and doing a second podcast with me, and we'll have 988 on the next episode and kind of discuss the resources that are available and everything like that. We talked just a little bit off camera. We think we covered everything. The big push right now is, if you are struggling, don't be afraid to ask for that help. Don't be afraid to go to your friends. Don't be afraid to pick up and call 911 or 988 or whatever. One thing that we did mention on the last one was, um, we kind of discussed this off camera as well, was that if you are struggling and you don't have cell service or a way to connect to somebody, you can always call 911, and 911 will connect you to somebody that can help you with that. So definitely don't be afraid to reach out and get help. All right. Well, again, we had Maddie here with our Encompass Mental Health aspect and in therapies that's going to be able to answer any of your calls and ready to go for you guys. And I want to thank her for coming in on the second one because again we had that technical glitch, but we got through this time and we made sure we did a couple cuts and a couple takes and made sure things that worked out right and was ready to go. So we thank you for coming in. Join us for our next podcast with 988.